Welcome to the world of telemedicine and how it's used to treat patients with chronic diseases. Today we're going to talk about a couple things. One, what is telemedicine? Two, we're going to look at a study that used telemedicine to treat patients with chronic diseases. And three, we're going to look at a couple cons to using telemedicine until it's a little bit more accessible to everyone in the country. According to Tera Weigel, health professionals use telemedicine to evaluate, monitor, and treat their patients. This works well for people with chronic disease because they are able to monitor from the convenience of their own home and sometimes treat them as well. Most people think of telemedicine as just virtual visits, like FaceTime, but it's so much more than that. It includes electronic medical record systems, types of medicine. It also includes being seen out in a rural area. Things like nurses traveling to your home and then reporting back to the doctor. All of that can be included in telemedicine. There's lots of benefits that come from telemedicine. For patients, it's convenience. It saves time. You don't have to go into a doctor's office where you have people that are sick sitting right next to you, especially if you're not sick yourself and you're just going in for a routine visit. It also is beneficial for doctors. It saves on efficiency, it saves on money, and it helps them monitor their patients better than they can when they're just seeing them once a month or once every couple months. Some studies show that perfect examples of how telemedicine can manage and treat chronic diseases, leading to improved overall health, less trips to the ER, and reduced hospitalizations. In 2011, the Veterans Health Administration saw over 300,000 patients using telemedicine for consultations. That's a huge amount of people that were able to be seen from the convenience of their own home. The need for monitoring chronic diseases is increasing due to growing population of elderly patients. Some people call this the silver tsunami. Non-communicable diseases like cardiovascular disease, diabetes, cancer, and chronic respiratory diseases like COPD are responsible for more deaths globally than any other causes combined. Many of these include diabetes, COPD, high blood pressure or hypertension, and heart failure, which can all be monitored using telemonitoring or telemedicine. Heart failure and COPD are the most frequent causes of non-scheduled hospital admissions in the country. So let's give an example. Meet Linda. She's a busy mom, an employee, and she's a wife. She has a busy, hectic schedule, and she has just been diagnosed with type 2 diabetes. With this newfound diagnosis, Linda has to change a lot of things about her lifestyle. She has to have a better diet, increase her exercise, and she has to have monitored visits to make sure her medications are what they're supposed to be and her overall health is not depleting.
But Linda, honey, look at this.
By having the use of telemedicine, she can do this from the comfort of her own home. She can use an app on her phone to monitor her diet and exercise. And she doesn't have to give up all of her time with her kids, her husband, and her job. In 2011 to 2016, a study was done in Spain that used telemedicine to monitor patients with chronic diseases. They ended up using a tablet to input their own health information, including vitals on a daily basis. There was alarms and alerts set up through the system so that a primary care nurse could catch anything that was out of the ordinary, bring it to a provider, and then by doing this, monitor the patients and treat them from home. Whether that meant changing their medications or having them come in for a visit, it drastically dropped their admissions to the emergency room and decreased mortality rates. They also used the tablets to input educational videos related to that person's chronic condition. That way they were able to be aware of their own health condition and manage it from home a little bit better. The study showed significant improvements for weight, heart rate, blood pressure, both systolic and diastolic, decreased by 10 and 44%. When it came to patients with diabetes, their A1C that was at 8% or higher dropped 44%. That's a huge amount when you're looking at a glycemic index and how these people are monitoring their everyday lives. Last but not least, hospital admissions significantly decreased before and after the study was over. Other studies have shown reduced mortality rates of up to 24% for heart failure patients. Best of all, patient satisfaction and quality of life improved. Not only patients, but family members of patients were a lot more comfortable knowing that their loved ones were monitored on a daily basis and their healthcare needs were taken care of appropriately and efficiently. Another study that we look at is a study where they use technology to monitor patients with chronic disease, but in a little bit different manner. Instead of using tablets, they actually put monitoring devices right on the patient. Their vitals, their O2 stats, even their motion was registered and measured, and data was collected to show that movement and vitals, either increasing or decreasing, were directly related to one another. By doing this, they were able to manage patients' medications a little bit better and manage their overall health to give them a better quality of life. This stopped so many patients from having to go into multiple ER visits, and it also decreased the risk that one of these side effects from their condition was going to permanently hospitalize them or worse, lead to death. So for both of these studies, we do have to realize that convenient sampling was used because they needed a patient with a certain chronic condition that they were able to put in the study and monitor, somebody that had accessibility to the internet, someone that knew how to use even slightly a tablet to start out with, so that they didn't have to give education on technology use right from the get-go. Unfortunately, there's two sides to every coin, and there are some cons that still exist with telemedicine. For example, with the study that we just talked about, you have a patient that's putting in their own vitals into a system daily. If you're working with elderly patients with chronic disease, they could forget to put in their vitals for the day. They could take their vitals wrong. They could forget how to use the system in general. By doing this, they aren't getting an accurate monitoring of their condition by professionals that are looking at their chart on a daily basis. That can create risks for both the patient and the provider. Another key need is accessibility. Many elderly patients don't have the internet or even a computer in their home. Medicare also is not quite jumped on the bandwagon just yet. They do offer some telemedicine services, and they promote electronic health records for doctors to use. They actually get a tax benefit at the end of the year if they're using their EHR to monitor certain things with that patient's chart. Last but not least is cost. Telemedicine is only required to be covered by insurance companies in 21 states in the United States so far. When you have a person coming from a low socioeconomic area, they usually can't afford their visits out of pocket if their insurance doesn't cover them.
Help me, I'm poor.
This in turn leads to health inequities due to the location that they live and the insurance that they have, at no fault of their own. We need to get these insurance companies to jump on the bandwagon and promote telehealth use all over the nation. A person's health can benefit from being able to monitor from their own home and manage their own health. This has drastic improvement for how well they manage their health if they're in control. Thank you guys for watching my presentation. If you have any questions or comments, please feel free to leave them.